Welcome to Cosmic Whispers, where cosmic mysteries come alive. Your journey beyond the stars begins now. Throughout human history, microscopic adversaries have waged war against our species. From the Black Death that claimed over 30% of Europe's population in the 14th century to the 1918 influenza pandemic that infected 500 million people worldwide, infectious diseases have shaped our societies in profound and devastating ways. As recently as 2020, the world witnessed how a novel coronavirus could rapidly transform from a localized outbreak into a global pandemic, claiming millions of lives and disrupting economies across continents. The question that haunts epidemiologists, public health officials, and governments worldwide remains: can we predict the next pandemic before it happens? Can we identify potential threats before they emerge, spread, and devastate populations? The answer may lie in one of humanity's most powerful technological innovations: artificial intelligence. Every great journey starts with a few brave explorers. Right now, Cosmic Whispers is just beginning, and your support means everything. If you enjoy unraveling the mysteries of the universe, hit subscribe. It's free and it helps us grow this community together. Pandemic prediction represents one of the most complex challenges in public health. Traditional surveillance systems rely heavily on reported cases, which means the response begins only after an outbreak has already started. By the time health authorities recognize a potential pandemic, the pathogen has often already spread, beyond containment. But what if we could shift from reactive to proactive approaches? Artificial intelligence offers unprecedented capabilities to process vast amounts of data from diverse sources: environmental sensors, social media posts, hospital admissions, flight patterns, and even searches on medical websites. These digital breadcrumbs, when analyzed collectively, might reveal patterns invisible to human observers. Consider the early warning signs of COVID-19. In December 2019, Blue Dot, an AI-powered infectious disease surveillance platform, detected an unusual cluster of pneumonia cases in Wuhan, China. The system alerted its clients about the potential threat on December 31, 2019, 9 days before the World Health Organization officially notified the public about the novel coronavirus outbreak. This wasn't fortune-telling. It was pattern recognition at a scale and speed impossible for human analysts. The foundation of pandemic prediction lies in understanding how diseases emerge and spread. Approximately 75% of emerging infectious diseases are zoonotic, jumping from animals to humans. This transmission often occurs at the complex intersection of environmental changes, wildlife trade, agricultural practices, and human behavior. AI systems can monitor these factors simultaneously across the globe, identifying high-risk zones where pathogens might make the species leap. Machine learning algorithms can analyze genetic sequences to estimate a pathogen's transmissibility, virulence, and potential for human-to-human transmission. Deep learning models trained on historical outbreak data can identify patterns that precede epidemic spread. Natural language processing can scan millions of social media posts and news articles for mentions of unusual symptoms or illnesses, creating a real-time global health sentinel. However, predictive systems face significant challenges. Data quality varies enormously across different regions. Many potential hotspots for disease emergence are in areas with limited surveillance infrastructure. Ethical concerns about privacy and surveillance must be balanced against public health benefits. And perhaps most importantly, prediction is not prevention. Identifying a threat is only valuable if it triggers effective countermeasures. As we stand at this technological frontier, the question becomes not just whether AI can predict the next pandemic, but how we might harness this foresight to create a safer world. The story of AI and pandemic prediction is one of data, algorithms, and computational power. But ultimately, it's about humanity's age-old struggle against microscopic threats that have shaped our past and continue to challenge our future. In 2015, a team of researchers at Boston Children's Hospital launched a platform called HealthMap that used artificial intelligence to scan online news reports, social media posts, and government alerts for signs of disease outbreaks. When analyzing data from West Africa, their algorithms detected something unusual. Mentions of a strange fever were appearing with increasing frequency. The system had identified the early signals of what would become the deadliest Ebola outbreak in history, days before official reports confirmed the epidemic. This is the promise of AI-powered disease surveillance, the ability to detect outbreaks earlier than traditional methods, potentially saving countless lives through rapid response. But how exactly do these digital epidemiologists work? At their core, predictive AI systems for pandemic surveillance rely on three fundamental capabilities: data collection at unprecedented scale, pattern recognition across disparate information sources, and predictive modeling that can anticipate how diseases might spread. Modern surveillance systems ingest terabytes of data daily from sources as diverse as satellite imagery, tracking environmental changes, climate data monitoring temperature and precipitation patterns, genomic databases, cataloging viral mutations, air travel manifests tracking human movement, and even internet search trends revealing when populations are researching certain symptoms. The ProMed Mail system, an internet-based reporting platform for infectious diseases, processes thousands of reports daily in multiple languages. When combined with machine learning algorithms, this constant stream of global health information becomes a powerful early warning system. During the early stages of COVID-19, AI systems monitoring these feeds detected anomalous patterns in pneumonia reports weeks before official recognition of the novel pathogen. Beyond simple detection, modern AI systems attempt to characterize emerging threats. Blue Dot's algorithm not only identified the initial cluster of COVID-19 cases, but also correctly predicted the next 11 cities where the virus would appear by analyzing global air travel patterns from Wuhan. This level of predictive specificity was previously unimaginable in epidemiology. The genetic frontier represents another critical dimension in pandemic prediction. Companies like Metabiota use machine learning to analyze viral genetic sequences, identifying which pathogens might be only a few mutations away from efficient human-to-human transmission. By monitoring these high-risk pathogens in animal populations, scientists can identify potential pandemic candidates before they make the species jump. Environmental monitoring adds another layer to prediction efforts. Deforestation, changing climate patterns, and agricultural expansion bring humans into contact with wildlife reservoirs harboring unknown pathogens. Satellite imagery analyzed by AI can identify regions where these interactions are intensifying, flagging potential spillover hotspots. The PREDICT project, funded by USAID, combined field surveillance in these high-risk zones with computational analysis to identify over 900 previously unknown viruses with pandemic potential. Social media has emerged as an unexpected ally in pandemic prediction. During the H1N1 outbreak in 2010, researchers discovered that Twitter data, reflecting public concerns about flu symptoms, closely matched official CDC surveillance data, but was available up to 2 weeks earlier. Today's systems monitor social platforms in dozens of languages, looking for clusters of posts mentioning symptoms consistent with emerging infections. Despite these impressive capabilities, AI surveillance systems face significant limitations. False positives can trigger unnecessary panic or response fatigue. Regional disparities in internet access and healthcare infrastructure create blind spots in global surveillance networks. And privacy concerns surrounding digital health monitoring remain unresolved, especially as systems become more sophisticated in tracking potential carriers of disease. The path toward pandemic prediction is built on the careful study of historical outbreaks. Each epidemic leaves behind a wealth of data, transmission patterns, genetic mutations, environmental conditions, and human responses that forms the training ground for artificial intelligence systems designed to prevent future crises. The 21st century has already witnessed numerous outbreaks that serve as crucial reference points. SARS in 2003, H1N1 influenza in 2009, MERS in 2012, Ebola in 2014, Zika in 2016, and COVID-19 in 2020. Each of these events has expanded our understanding of how pandemics emerge and spread in our interconnected world. Consider the SARS outbreak of 2003. The disease emerged in Guangdong Province, China, before spreading to 29 countries. It infected approximately 8,000 people and caused nearly 800 deaths worldwide. While modest in scale compared to later outbreaks, SARS provided valuable insights into how coronaviruses can jump from animal reservoirs to humans and then achieve human-to-human transmission. Researchers at the University of California, Los Angeles have used SARS data to train machine learning algorithms that can identify coronavirus sequences with high potential for human transmissibility. By analyzing the spike protein features that enabled SARS-CoV-1 to infect human cells, these systems can now scan emerging coronaviruses and flag those with similar characteristics as high-risk candidates for surveillance. The 2014 to 2016 Ebola outbreak in West Africa offered different lessons. This epidemic demonstrated how social and cultural factors, particularly funeral practices, healthcare-seeking behaviors, and community trust in authorities, dramatically influence disease spread. AI systems developed by organizations like Global.Pulse now incorporate social dynamics data alongside biological factors, recognizing that predicting outbreaks requires understanding human behavior as much as viral biology. Perhaps the most data-rich pandemic in history, COVID-19, continues to teach us about the complex interplay of factors driving global outbreaks. The unprecedented scale of data collection during this pandemic, from viral genomic sequences uploaded in real time to mobile phone mobility data tracking population movements, has created training datasets that far exceed anything previously available to AI researchers. Scientists at the Institute for Health Metrics and Evaluation have developed neural networks that can identify patterns in COVID-19 transmission that correlate with specific intervention measures across different countries and cultural contexts. These systems are now being adapted to model how future pathogens might spread under various containment strategies. Beyond specific outbreaks, long-term surveillance data reveals broader patterns. Researchers at the University of Edinburgh have used 50 years of influenza surveillance data to train algorithms that can predict seasonal flu severity with 80% accuracy 3 weeks before peak transmission. These same techniques are being adapted to identify the early signatures of pandemic potential in seasonal respiratory infections. Environmental data adds another crucial dimension. Satellite imagery tracking deforestation in Central Africa, combined with climate data showing changing rainfall patterns, has been correlated with historical Ebola outbreaks. AI systems at EcoHealth Alliance now monitor these environmental signals in real time, identifying regions where conditions mirror those preceding previous spillover events. The power of these historical analyses lies in their ability to identify common factors across seemingly different outbreaks. Machine learning excels at detecting subtle correlations in complex datasets that might escape human analysts. By processing information from dozens of past epidemics simultaneously, AI systems can identify recurring patterns that often precede epidemic spread, creating an evidence-based, early warning system. However, historical data has limitations. Novel pathogens may behave in ways not represented in existing datasets. Cultural and technological changes mean that diseases spread differently today than in previous decades. And many historical outbreaks occurred in regions with limited surveillance, creating gaps in our knowledge base. Despite these challenges, each outbreak adds to the collective knowledge that powers predictive systems. As AI researcher Caitlin Rivers from Johns Hopkins University noted, "We're not trying to build a crystal ball. We're building systems that learn from history to give us a better chance at identifying the next threat before it becomes a crisis." Deep within the microscopic world of pathogens lies perhaps the most valuable data for pandemic prediction: the genetic code. The viral genome, that twisted strand of RNA or DNA, contains crucial information about a pathogen's origin, transmission, capabilities, virulence factors, and potential for adaptation to human hosts. As sequencing technologies have advanced, Our ability to read and interpret this genetic information has transformed pandemic surveillance. In 2003, sequencing the original SARS coronavirus genome required months of intensive laboratory work. By 2020, laboratories were sequencing the SARS-CoV-2 genome within 48 hours of detection. Today, portable sequencers like Oxford Nanopore's Minion can decode viral genomes in remote field locations with minimal infrastructure, generating data that feeds directly into global surveillance networks. This genomic revolution has created an unprecedented opportunity for artificial intelligence applications in pandemic prediction. Machine learning algorithms can now analyze millions of viral sequences to identify patterns associated with human transmissibility or virulence. Systems trained on known pandemic viruses can flag novel pathogens with similar genetic features, creating an early warning system based on biological characteristics, rather than waiting for human cases to emerge. The Global Virome Project, an ambitious international research effort, aims to identify and characterize the estimated 500,000 viruses with zoonotic potential circulating in mammal and bird populations. This massive undertaking would be impossible without AI systems capable of analyzing and categorizing enormous genomic datasets. As researchers identify these viral reservoirs, machine learning algorithms help prioritize which pathogens warrant closer monitoring based on their genetic similarity to known human pathogens. Perhaps most impressively, deep learning systems can now predict which specific mutations might enable an animal virus to infect humans. Researchers at the Massachusetts Institute of Technology have developed neural networks that can analyze influenza sequences and predict with 70% accuracy whether specific viral strains could efficiently replicate in human cells without ever handling the actual virus in a laboratory. The genomic surveillance network for SARS-CoV-2 demonstrates the power of this approach. As the virus spread globally, laboratories worldwide uploaded tens of thousands of genomic sequences to databases like GISAID. Machine learning algorithms continuously monitored these sequences, identifying emerging variants with mutations that might impact transmissibility, immune evasion, or virulence. This system provided early warnings about concerning variants like Alpha, Delta, and Omicron, sometimes weeks before traditional epidemiological data confirmed their changed behavior. Beyond tracking known pathogens, metagenomic sequencing allows scientists to sample environments, from bat caves to urban sewage, and identify all genetic material present, including previously unknown viruses. AI systems then compare these novel sequences against databases of known pathogens, flagging those with features suggesting pandemic potential. Kevin Esvelt, a biologist at the Massachusetts Institute of Technology, has proposed a more proactive approach called the Nucleic Acid Observatory. This system would use advanced sequencing methods to continuously monitor wastewater and other environmental samples for any unusual or rapidly evolving pathogen sequences, essentially creating a genetic smoke alarm for emerging biological threats. The predictive power of genomic surveillance extends beyond identifying potential pandemic pathogens. Once an outbreak begins, genomic data combined with AI analysis can predict how a virus might evolve. Systems developed at the Fred Hutchinson Cancer Research Center can analyze early SARS-CoV-2 sequences and predict with remarkable accuracy which specific mutations would later emerge as the virus adapted to human transmission. Despite these advances, genomic prediction faces significant challenges. Many high-risk regions lack sequencing infrastructure, creating blind spots in global surveillance. Interpreting genomic data requires contextual information about host species, environmental conditions, and human-animal contact, data that is often incomplete. And predicting how genetic features translate to epidemic behavior remains an inexact science. Nevertheless, the genomic revolution represents our most promising frontier for moving from reactive to proactive pandemic response. As computational biologist Emma Hodcroft observes, for the first time in human history, we can read the genetic blueprint of our microscopic adversaries in real time. Combined with artificial intelligence, this gives us a fighting chance to see the next pandemic coming before it arrives. In the digital age, outbreaks leave electronic footprints long before they appear in official medical reports. Every day, millions of people search for symptoms online, discuss illnesses on social media, purchase medications, and visit healthcare facilities, creating a vast digital ecosystem that reflects population health in near real time. Artificial intelligence systems have become increasingly adept at mining this data to detect disease outbreaks earlier than traditional surveillance methods. Google's Flu Trends project, launched in 2008, represented one of the first attempts to use internet search data for disease surveillance. By analyzing millions of search queries related to influenza symptoms, the system aimed to predict flu outbreaks up to 2 weeks before they appeared in official CDC reports. While the original implementation faced challenges with accuracy, the concept demonstrated how digital behavior could serve as an early warning system for disease spread. Today's digital surveillance systems have evolved far beyond simple search analysis. HealthMap, developed at Boston Children's Hospital, uses natural language processing to scan online news reports, social media posts, and official alerts in 65 languages. The system automatically classifies this information by disease, location, and time, creating a real-time global map of potential outbreaks. During the early stages of the COVID-19 pandemic, HealthMap detected unusual reports of pneumonia cases in Wuhan nearly a week before official notifications. Social media platforms provide particularly rich data for outbreak detection. Twitter alone generates over 500 million messages daily, many containing health-related information. Machine learning algorithms developed at San Diego State University can identify influenza-related tweets with 95% accuracy and correlate their geographic distribution with actual disease prevalence. Similar systems monitor platforms like Weibo in China and VK in Russia, creating a global network of social listening posts for emerging health threats. Beyond explicit mentions of illness, AI systems can detect subtler signals. Researchers at Harvard University demonstrated that changes in the types of food delivery orders placed online, particularly shifts toward bland, comfort foods, correlated strongly with influenza outbreaks in specific neighborhoods. Similarly, unusual patterns in public transportation usage or workplace absenteeism can indicate emerging health issues before individuals seek formal medical care. Mobile phone data adds another dimension to digital surveillance. Population movement patterns derived from anonymized location data help predict how diseases might spread between regions. During the Ebola outbreak in West Africa, Flowminder Foundation used mobile phone records to track population movements in affected countries, helping health authorities predict where the disease might appear next and allocate resources accordingly. Some surveillance systems leverage the distributed power of human observation. Participatory surveillance platforms, like FluNearYou in the United States and InfluenzaNet in Europe, allow volunteers to report symptoms through mobile apps. Machine learning algorithms analyze these self-reports alongside traditional data sources, creating hybrid systems that combine the speed of digital surveillance with human-verified information. Perhaps the most sophisticated approach combines multiple digital streams with environmental and biological data. The PREDICT project, funded by USAID, integrated field sampling in high-risk regions with analysis of digital disease signals, satellite imagery of environmental changes, and genomic sequencing of detected pathogens. This holistic approach identified numerous viruses with pandemic potential before they caused large outbreaks. Privacy concerns represent a significant challenge for digital surveillance. Systems must balance public health benefits against individual rights to privacy and confidentiality. Approaches like differential privacy, which adds calibrated noise to datasets to protect individual identities while preserving statistical utility, offer potential solutions. Similarly, federated learning techniques allow AI models to be trained across multiple data sources without centralizing sensitive information. Another limitation is digital inequality. Regions with limited Internet access or healthcare infrastructure generate fewer digital signals, creating potential blind spots in global surveillance networks. Addressing this disparity requires developing surveillance methods appropriate for different technological contexts, from smartphone apps in urban centers to basic text messaging systems in rural areas. Despite these challenges, digital disease detection represents a transformative approach to pandemic preparedness. As epidemiologist John Brownstein notes, in the 21st century, the first signs of an outbreak may not be a patient in a clinic, but a pattern in our digital exhaust. AI helps us find the signal in that noise. Predicting the next pandemic represents only half the battle. The true value of foresight lies in our ability to translate early warnings into effective preventive action. Artificial intelligence is increasingly bridging this gap between prediction and prevention, not only by identifying potential outbreaks, but by optimizing response strategies before pathogens gain a foothold in human populations. Scenario modeling forms the cornerstone of this preventive approach. Using data from past outbreaks, AI systems can simulate how a novel pathogen might spread through different populations under various intervention strategies. During the early stages of COVID-19, the Institute for Disease Modeling used agent-based simulations to predict the impact of different non-pharmaceutical interventions, from school closures to mask mandates, helping policymakers select the most effective combination of measures for their specific contexts. These simulation capabilities have grown increasingly sophisticated. Systems developed at Imperial College London can now model potential outbreaks at multiple scales simultaneously, from individual interactions to global spread patterns. By incorporating detailed data on transportation networks, healthcare infrastructure, population demographics, and cultural practices, these models provide tailored prevention recommendations for specific regions or communities. The Global Epidemic and Mobility Model GLEAM, used by researchers worldwide, combines real-time population mobility data with epidemic models to forecast disease spread across 8,500 subpopulations in 220 countries. During the Zika outbreak of 2016, GLEAM accurately predicted the pattern of international spread months in advance, allowing health authorities to mobilize resources ahead of local transmission. Beyond modeling existing threats, AI systems help design surveillance strategies to detect new pathogens before they spread widely. By analyzing factors associated with past spillover events, from ecological disruption to wildlife trade patterns, algorithms can identify high-priority surveillance zones where limited resources will yield the greatest protective benefit. The Spillover Project uses this approach to optimize sampling locations across Southeast Asia, focusing attention on specific bat caves, wet markets, and farms with the highest probability of harboring novel coronaviruses. Pharmaceutical interventions benefit equally from predictive intelligence. Vaccine development traditionally requires years, but AI systems are accelerating this timeline dramatically. When SARS-CoV-2 emerged, Moderna used machine learning algorithms to design their mRNA vaccine candidate within 48 hours of receiving the viral genome sequence. Similar systems are now being used to develop universal vaccines targeting conserved regions of viral families with pandemic potential, potentially providing partial protection against novel pathogens when they emerge. Therapeutic discovery has undergone similar transformation. Deep learning models developed at in silico medicine can screen billions of potential drug compounds against viral protein targets, identifying promising candidates for laboratory testing within days rather than months. During the COVID-19 pandemic, AI systems successfully identified several existing medications with antiviral properties against SARS-CoV-2, including baricitinib, which later received emergency authorization for treating severe cases. Perhaps most importantly, artificial intelligence is helping design early intervention protocols that can be activated at the first sign of a novel pathogen. These playbooks combine multiple strategies, from targeted testing and contact tracing to temporary mobility restrictions, calibrated to interrupt transmission before widespread community spread occurs. The Coalition for Epidemic Preparedness. Innovations (SEPI) uses simulation data to develop region-specific response plans that can be immediately implemented when surveillance systems detect an outbreak with pandemic potential. Ethical challenges abound in this preventive landscape. Intervention measures often involve trade-offs between public health benefits and economic or social costs. AI systems can help quantify these trade-offs, but cannot resolve the underlying value judgments. Privacy concerns surrounding digital contact tracing during COVID-19 illustrated the tension between technological capabilities and societal acceptance. Resource allocation presents another ethical dilemma. Predictive systems might identify dozens of potential threats simultaneously, but prevention resources remain limited. Should we prioritize the pathogens with the highest probability of emergence, those with the greatest potential severity, or those affecting the most vulnerable populations? These decisions extend beyond technical analysis into questions of global health equity and justice. Despite these challenges, integrated prediction prevention systems represent our best hope for breaking the cycle of pandemic devastation. As Mark Lipsitch from Harvard's T.H. Chan School of Public Health observes, the true measure of success isn't how accurately we can predict the next pandemic, but whether we can prevent it from becoming a pandemic in the first place. As we stand at this pivotal moment in human history, the integration of artificial intelligence into pandemic surveillance offers both unprecedented promise and profound responsibilities. The systems being developed today will likely determine how humanity navigates biological threats for generations to come. Where might this journey lead us in the decades ahead? The immediate future will likely see the emergence of truly global, real-time surveillance networks that combine multiple data streams, from genomic sequencing and environmental monitoring to digital behavior analysis, into unified early warning systems. The World Health Organization's Hub for Pandemic and Epidemic Intelligence, launched in 2021, represents an early prototype of this approach, but more comprehensive systems are under development. Within 5 years, experts anticipate the creation of an immune system for the planet, a globally distributed network of sensors continuously monitoring for biological threats. This system would combine environmental sampling devices, wastewater surveillance infrastructure, genomic sequencing centers, and digital analytics platforms into a cohesive detection framework spanning both high-income and low-resource settings. Advances in portable sequencing technology will democratize genomic surveillance. Technologies like Oxford Nanopore's Minion have already reduced the size of a DNA sequencer from room-sized equipment to a device smaller than a smartphone. Future iterations may enable continuous environmental monitoring in high-risk locations, from wildlife markets to hospitals, automatically alerting authorities when novel pathogens are detected. Synthetic biology presents both opportunities and challenges for pandemic prediction. As the technology to create or modify organisms becomes more accessible, predictive systems must expand to monitor not only natural evolutionary processes, but also potential engineered threats. Programs like Secure DNA are developing AI systems that can screen synthetic DNA orders to prevent misuse while preserving legitimate scientific applications. Quantum computing may transform our predictive capabilities. Current AI systems struggle with the computational complexity of modeling viral evolution or simulating how pathogens might spread through global networks. Quantum algorithms could potentially analyze these complex systems more efficiently, enabling more accurate forecasting of evolutionary trajectories and transmission dynamics. Personalized early warning systems represent another frontier. Wearable devices already monitor various physiological parameters, from heart rate to skin temperature, generating continuous data streams that reflect individual health status. Future systems might detect subtle changes indicating infection before symptoms appear, alerting wearers to potential exposure and preventing onward transmission through early isolation. Integration with climate prediction models will become increasingly important. As global temperatures rise, the geographic range of disease vectors like mosquitoes and ticks expands, potentially introducing pathogens to immunologically naive populations. AI systems that combine climate projections with epidemiological models can identify emerging risk zones decades in advance, guiding long-term adaptation strategies. Perhaps most transformatively, we may witness the development of autonomous response systems that not only predict outbreaks, but automatically initiate containment measures. Smart cities might reconfigure ventilation systems when airborne pathogens are detected, while transportation networks adjust to reduce transmission without human intervention. Such systems would require careful governance frameworks, balancing rapid response against democratic oversight. These technological possibilities raise profound questions about governance, equity, and ethics. Who controls these powerful predictive systems? How do we ensure that benefits are shared globally rather than concentrated in wealthy nations? What recourse exists when predictive systems make mistakes with significant consequences? These questions cannot be answered through technology alone, but require inclusive deliberation across diverse stakeholders. The challenge of data sharing remains particularly acute. Effective global surveillance requires open exchange of information across political boundaries, yet concerns about sovereignty, security, and economic advantage often impede collaboration. Future systems must include incentive structures and governance mechanisms that make data sharing both secure and mutually beneficial. Equity considerations will determine whether predictive technologies reduce or reinforce global health disparities. If advanced surveillance systems remain concentrated in high-income countries, they may simply accelerate response in already privileged regions while leaving vulnerable populations unprotected. Designing systems specifically for low-resource contexts, with appropriate technology, training, and sustainable funding models, must be a priority rather than an afterthought. Despite these challenges, the direction is clear. Humanity is building an unprecedented capacity to anticipate and prevent pandemic threats. This capacity emerges not from any single breakthrough, but from the integration of diverse technologies, genomic sequencing, environmental sensing, digital surveillance, and computational modeling into coherent systems greater than the sum of their parts. As infectious disease expert Anthony Fauci observed shortly before his retirement, the question is no longer whether we can predict pandemics, but whether we will build the systems and summon the political will to act on those predictions. The artificial intelligence revolution offers powerful new tools for pandemic foresight. How we deploy them will shape the health security landscape for generations to come. In this new era of pandemic intelligence, one truth remains constant. Microscopic threats will continue to emerge from the complex interaction of humans, animals, and ecosystems. But for the first time in our species' long struggle against infectious disease, we can begin to see these threats taking shape before they reach us, offering a precious window for prevention that previous generations could only imagine.